Welcome to the CAASN channel. Our topic for today is convalescent plasma therapy in COVID-19. My name is Abazar Habibinia. I have an MD degree and I'm the director of the Canadian Academy of Sport Nutrition. Subscribe to the CAASN channel on YouTube to enjoy the information that we share on a regular basis about medicine, weight loss, fitness, and sport nutrition. Okay, today we are going to discuss about plasma therapy in COVID-19. Through this presentation, you will learn what plasma is, how it is separated from the blood, what's inside the plasma, what are the indications of plasma therapy in medicine in general, and then we're going to review immune response and plasma therapy in COVID-19, and we will finish the presentation with an answer to this question: is plasma therapy safe? I have prepared interesting slides for you, and I'm gonna talk on the slides and I'll be back at the end. Let's go with the slides. Convalescent plasma therapy in COVID-19. This illustration shows you in general why we do convalescent plasma therapy. When someone has recovered from COVID-19, usually they're gonna have hyperimmunoglobulin. Please keep in mind that those people that have recovered from COVID-19, they may develop active immunity. I'm going to talk about immune response in COVID-19 later. And through convalescent plasma therapy, we transfer hyperimmunoglobulin from recovered patient to critically ill patient for two purposes: to speed up their recoveries and to induce passive immunity in them. But let's see if convalescent plasma therapy is as simple as it looks. As you know, COVID-19 is caused by SARS coronavirus type 2, and it has no definitive cure, and the treatment is generally supportive, such as antiviral medications, antibacterial antibiotics, oxygen therapy, vitamin therapy, and convalescent plasma therapy. But let's see what plasma is. Plasma is the non-cellular part of the blood. Basically, it is the light yellowish liquid that holds blood cells. Let me show you something in here. If we take a blood from someone and we put it in a lab tube, red blood cells, they will sit at the bottom. Red blood cells you can see in here, it's going to be at the bottom. They are about 45%. In the middle we have white blood cells and platelets. They are about 1%. And the upper part, which is yellowish in color, it's called plasma, which is 55%. So 55% of your blood is plasma. An average person has about 42 liters of fluid in his body. Please keep in mind that when I say average person, that means someone with body weight about 150 pounds or 70 kg. So an average person has about 42 liters of fluid in his body, and out of 42 liters, 28 liters are inside the cells and 14 liters are outside the cells. And out of 14 liters, 11 liters we call it the medicine interstitial fluid. Interstitial fluid usually surrounds the body's cells, and plasma is going to be about 3 liters. So an average person has about 3 liters of plasma in his body. But let me show you how you can calculate your own plasma volume. First, you need to calculate your own blood volume. Do you know how much blood you have in your body? It is about 75 ml per kg of your body weight. Let me give you an example. Well, I am 72 kg. 72 times 75, I'm going to get 5,400 ml or 5.4 liters. So I have about 5.4 liters of blood in my body. Then we're going to calculate plasma. Now you know 55% of your blood is plasma. So 5.4 times 55%, I'm gonna get 2.97 liters, which is almost the same liters that I showed you in previous slide. But definitely plasma volume depends on your body weight. Plasmapheresis. Plasmapheresis actually is the process of separating plasma from the blood in a device in medicine which is called apheresis device. We have two techniques to separate plasma from the blood. The first one, which is the most famous one, is called centrifugation. Centrifugation usually is performed by blood bankers. This method has a unique advantage. There is no limit on the size of the molecules that are going to be removed. The second technique is called filtration, which is least common. Filtration usually is done by nephrologists and intensivists. But about filtration technique, there is definitely a disadvantage. And this is the disadvantage. The size of the molecules that are going to be removed is limited by the size of the pore of the filter. How many types of blood plasma therapy do we have? We have two types of them. The first one is called therapeutic plasma exchange. As you can guess from the name, in this type, plasma is removed from the patient and it is replaced by either a fresh plasma or by saline, albumin, or even starch solutions. The second type is called therapeutic plasma transfusion. In here, there is no exchange. In here, plasma is obtained from a donor and it is given to a recipient without removing his or her plasma. And convalescent plasma therapy is a subtype of therapeutic plasma transfusion, in which plasma from recovered patients is given to sick people to accelerate the recovery and healing. When donating blood, since donors usually they're gonna give about 1 unit of blood, which is about 500 ml, and they should be in good health. In general, there is no need to replace the removed plasma in donors. But let's see what's inside the plasma. Number one, plasma contains globulins. Globulins, they are a group of proteins. We have different types of globulins: alpha 1, alpha 2, beta, and gamma. Immunoglobulins are a group of gamma globulins. And right now, you know from the second slide that the purpose of plasma therapy is to transfer immunoglobulins. And plasma definitely contains blood coagulation factors, proteins, especially albumin, electrolytes, more sodium and chloride, less potassium, and some calcium and magnesium, and glucose, phospholipids, cholesterol, urea, lactic acid, creatinine, and a couple of more things. Well, let me show you something interesting about immunoglobulins. Immunoglobulins are antibodies produced by your body to protect you. As you can see on this slide, we have 5 types of immunoglobulins in human. We call them IgG, IgM, IgA, IgD, and IgE. When you develop COVID-19, or in general when you have exposure to any viral infection, 2 most important ones are IgM and IgG. So when you develop any viral infection, your body first is going to produce IgM to protect you. That's why the function of IgM is primary immune response, and IgG is gonna come later, and that's why the function for IgG, we call it secondary immune response. Then we have over there IgA. IgA basically is mostly found in body secretions, for example, in saliva, tears, and human milk. And we call them secretory IgA. Secretory IgA prevents microbes, bacteria, and viruses from attaching to mucous membranes, let's say inside the mouth, inside your nose, and airways. And IgD works along with IgM and IgE. IgE immunoglobulin is going to mediate immediate hypersensitivity reaction. Basically, IgE involves in, let's say, allergy. And as you can see, the most common form of immunoglobulin in human is IgG, which is about 75% of total immunoglobulin in the blood. And actually, IgG is the only one that can pass through placenta to go from a mother to her baby. But why blood plasma therapy? I mean, what are the indications of blood plasma therapy? Okay, in here I'm going to show you the indications for blood plasma therapy in medicine. In medicine, we do blood plasma therapy for four reasons. We're going to review together. Number one, to remove autoantibodies. Autoantibodies are antibodies produced by the immune system that attack the person's, his or her own basically body. That's why they develop autoimmune diseases. The second reason is to remove immune complexes. Immune complexes are formed by binding antibodies to multiple antigens. Then those immune complexes, they sit in a certain area of the body and they create a chaos. And the third reason is this, to remove abnormal proteins or harmful substances. I'm going to give you example later on. And number four, or the reason for, is to transfer protecting immune proteins or hyperimmune globulins. COVID-19 definitely is going to be in reason number four. But let me give you a few examples of medical conditions for each reason. The first reason was to remove autoantibodies. There are many medical conditions that usually in them we have autoantibodies. They cause lots of trouble. That's why one of the treatment option in medicine is to do blood plasma therapy to remove those autoantibodies. There are many of them. I have listed in here the most common ones, and as you can see in here, multiple sclerosis actually is at the top of the list. They have strange names, you don't have to know, but I had to put in here just to show you that blood plasma therapy is not something new in medicine. It's definitely an old intervention that we use for many medical conditions. The second reason was to remove immune complexes. I have listed in here top three common medical conditions. We call them SLE and rheumatoid arthritis. Immune complexes, they play a major role in developing those conditions. That's why they do blood plasma therapy to remove immune complexes, basically to accelerate their healing and recovery. Reason number three was to remove abnormal proteins or any harmful substances. As I said, you can see over there many medical conditions with strange names. We have to know, you don't need to know the most famous medical condition in which we do plasma therapy is called TTP, thrombotic thrombocytopenic purpura. And in this one, Wilson disease, usually one of the treatment options is blood plasma therapy to remove excessive amounts of copper from the patient's body. And the reason four was to transfer protecting immune proteins or hyperimmune globulins from recovered patients to someone else. And you can see over there when someone develops infection with hepatitis B virus, varicella zoster virus, and cytomegalovirus, they're gonna have in their bodies hyperimmune globulins, and definitely COVID-19 is here. This is the sum up of convalescent plasma therapy. Let's review together how the process is done. Anticoagulated whole blood is obtained from a recovered donor. Then the bag of whole blood is centrifuged. This is the first centrifugation to separate red blood cells from other components. Then packed red blood cells are obtained and stored at, as you can see in here, at 1 to 6 centigrade degrees. Then we're gonna have over there plasma that contains platelets and white blood cells. Then through a process which is called local reduction, white blood cells will be removed and we're gonna have a plasma that contains platelet only. And in here, they're gonna do the second centrifugation to separate plasma from platelet. Then platelet concentrate is obtained and stored at 20 to 24 centigrade degree. Then when they have the pure plasma is given to recipient immediately, or plasma can be frozen and stored within 8 hours, which is a medicine we call it fresh frozen plasma, and they save it to use later for someone else. Let's review immune response in COVID-19. I took this graph and image from JAMA network from an article that has been published on, as you can see in here, May 6, 2020. You can see in here that the two immunoglobulins will be produced following the COVID-19 infections are IgM and IgG. As you can see in here, IgM the body is gonna start producing IgM around week 2, and IgM is gonna peak around week 3, then it's gonna start declining and is gonna go down to the lowest level around week 6 or 7. But you can see in here, IgG is gonna start from the second week. Usually IgG, the body is gonna start producing IgG a little bit later on after IgM, but in here on this graph they show sort of basically the body's got produced at the same time, but we have lots of other images and graphs that IgG is gonna come definitely later. And also you can see in here IgG again is gonna pick around week 3 and is gonna stay higher. This is the one that is going to produce long-term immunity, and this is the reason that we are going to do convalescent plasma therapy to transfer hyperimmune IgG from recovered patient to critically ill patients. Please keep in mind that detecting antibodies in COVID-19 patients is not necessarily associated with clinical improvements. And for some reasons that we do not know in medicine yet, it seems that some patients do not develop a humoral immune response. That means there are patients that they are unable to detect those two antibodies, IgM and IgG. And detection of IgG and IgM antibodies does not necessarily confer long-lasting immunity. So post-infection immunity in COVID-19 is uncertain at the moment, and new information and evidence are emerging every day. The immune response to COVID-19 has not been fully understood yet. However, according to the current data that we have, it may provide immunity against reinfection, at least for a short while. Also, there are other papers that they have been published, and they say that they have been able to detect those antibodies up to 40 days from the moment the person starts showing symptoms, and these findings support the temporary immunity hypothesis. How effective is convalescent plasma therapy in COVID-19. Plasma therapy is an old medical intervention for a new challenge. Actually, plasma therapy was used during Spanish flu outbreak back to 1918, and also plasma therapy was used for patients with SARS, Ebola, and Lassa fever. The first article about plasma therapy in COVID-19 was published on March 27, 2020. This was the title of the article: Treatment of 5 critically ill patients with COVID-19 with convalescent plasma. This study had been conducted in China from January 20th through March 25, 2020. And actually, they found significant clinical improvement by doing plasma therapy. For that study in China, they used a few criteria to select patients for plasma therapy. And these are the criteria they had to use to choose a recipient for plasma therapy: severe and rapidly progressing pneumonia, those patients that they had a high viral load continuously even though they were on antiviral medications, those patients they had a low O2 saturation, and those patients they were on mechanical ventilation. But because in that study the sample size was too small, this was the reason that why they couldn't come up with the final and definitive conclusions. Also, we are getting sporadic reports from other countries that convalescent plasma therapy effective in critically ill COVID-19 patients. Canadian trial in convalescent plasma therapy. On April 7, 2020, it was announced that the world's largest clinical trial about convalescent plasma therapy in COVID-19 has been launched in Canada. This trial is a collaboration between the Canadian Transfusion Research Network, the McMaster Centre for Transfusion Research, Canadian Blood Services, Hema-Quebec, and academic partners across the country. And the initial number of patients involved is approximately 1,000 patients. Selecting plasma donors and recipients in this study could be the biggest challenge of the trial. And we have to wait until they publish the research paper about Canadian trial, but I am confident that it will be positive. No matter what the results of the Canadian trial will turn out to be, plasma therapy can be an empirical treatment option for critically ill COVID-19 patients, like any other medical conditions for which plasma therapy is being used at the moment. Until the virus disappears by itself or it is controlled somehow, an effective treatment for COVID-19 remains a matter of dispute. Is convalescent plasma therapy safe? Of course, it is not that safe. In here, we're going to review complications of convalescent plasma therapy. Number 1, allergic reactions. Usually, allergic reactions are caused by plasma proteins, and the most common form of allergic reactions are urticarial skin eruptions. Number 2, anaphylactic reactions. Anaphylactic reactions following plasma therapy could show itself as difficulty breathing, cough, nausea, vomiting, hypotension, and even a respiratory arrest. Number 3, one of the fatal complications of plasma therapy, it's called TRALI, transfusion-related acute lung injury. Usually a TRALI, it is among the most common cause of transfusion-related fatality. TRALI can happen during or within 6 hours of transfusion, and it happens usually because of the transfusion of donor's plasma that contains high titer of anti-HLA antibodies that bind recipient's white blood cells. And here are the risk factors for developing TRALI: smoking, chronic alcohol abuse, shock, liver surgery, especially if someone had liver transplantation, or if the patient was on mechanical ventilation with over 30 centimeters water pressure supports. And when someone develops TRALI, usually they're going to have signs and symptoms of hypoxia and pulmonary edema. Complication number 4, it's something we call it alloimmunization. The plasma recipient, the person who has received neoplasma, may become alloimmunized to plasma proteins from donor. What does it mean? That means the recipient is gonna develop antibodies against antigens and proteins that has received through plasma from a donor. Number 5, fluid overload. This depends on how many units of plasma you're gonna give to patient. Number 6, electrolyte imbalances. Complication number 7, hypotensive reactions. Plasma from people that they take AC inhibitors may have increased levels of bradykinin, which can cause hypotension. You see, there are many people that they take AC inhibitors. AC inhibitors, there are a group of medications that are prescribed for high blood pressure. If someone is taking AC inhibitor, those people, they're going to have definitely higher amount of bradykinin in their body. And if we use their plasma, bradykinin in recipient can cause a drop in blood pressure. And number 8, transmission of infectious agents. Definitely there are few infectious agents, especially viruses, that can be transmitted through plasma therapy. There are 6 of them, and I have listed in here for you. Hepatitis B, hepatitis C, HIV type 1, cytomegalovirus, HTLV type 1, and parvovirus B19. Well, let's see what are the problems with convalescent plasma therapy. Number 1, selecting donors is not gonna be easy to select those people from which patients we're gonna get plasma. So they have to choose those people. They don't have any high-risk lifestyle such as IV drug use. They have to choose those donors. They don't have medical conditions and they didn't have any exposure to transmissible pathogens. And the second problem is selecting potential recipients. You can't walk around and basically do plasma therapy in every single patient. So in medicine, they have to set criteria. If someone basically meet those criteria, they're gonna do plasma therapy. And number 3 is that definitely convalescent plasma therapy, it is expensive and time consuming, and it is not possible in every hospitals, and not every medical staff, they have proper training about it. I really hope you learned something interesting today, because we make science easy to understand. Now you know. If you don't want to miss the videos that we post on a regular basis on CAASN channel, you can subscribe to our channel. To support us, you can share, like, or comment on this video. Until next time, stay safe, stay connected.